Assalamu alaikum. My name is Zara Wasim, and today the topic of my presentation is chemical peel, procedure before and after impacts on the skin, and more. What is a chemical peel? Chemical peels are cosmetic treatments that can be applied to the face, hands, and neck. They're used to improve the appearance or feel of the skin. During this procedure, chemical solutions will be applied to the area being treated, which causes the skin to exfoliate and eventually peel off. Once this happens, the new skin underneath is often smoother, appears less wrinkled, and may have less damage. There are different types of chemical peels, such as light peel, medium peel, and deep peel. Why do you get a chemical peel? There are many reasons people may get a chemical peel. They may be trying to treat many things such as acne scars, sun damage, hyperpigmentation, wrinkles and fine lines, scars, uneven skin tone or redness, and even melasma. What does a chemical peel do? Chemical peels have a lot of benefits. These include deep chemical exfoliation, facial rejuvenation, unclogging pores, brightening skin tone, enhancing the absorption of other skin products, reducing the depth of wrinkles or acne scarring. Types of chemical peels. There are three types of chemical peels that you can get. These include superficial peels, also known as light peels, which use mild acids like alpha hydroxy acid to gently exfoliate. It only penetrates the outermost layer of the skin. Medium peels, which use trichloroacetic or glycolic acid to reach the middle and outer layer of scales. This makes it more effective for removing damaged skin cells. While in deep peels, it fully penetrates the middle layer of the skin to remove damaged skin cells. These peels often use phenol or trichloroacetic acid. How is a chemical peel done? Chemical peels are typically done in office. Deep peels may be done in an outpatient surgical facility. Before the procedure, your face will be cleaned and the eye protection like goggles or gauze may be applied. The doctor may numb the area with a topical anesthetic, especially if you're receiving a deep peel. For deep peels, your doctor may also use a regional anesthetic, which will numb large areas. They are particularly likely to do this if you're having your face and neck treated. For deep peels, you may also be given an IV and your heart rate will be closely monitored. Now we'll discuss how light, medium, and deep peels are done. Light peels. During a light peel, a cotton ball, gauze, or brush will be used to apply a chemical solution like salicylic acid to the area being treated. The skin will start to whiten and may have a slight stinging sensation. Once complete, the chemical solution will be removed or a neutralizing solution will be added. During a medium chemical peel, your doctor will use a gauze, special sponge, or a cotton-tipped applicator to apply the chemical solution to your face. This may contain glycolic acid or trichloroacetic acid. A blue color may be added to the trichloroacetic acid, commonly known as blue peel. The skin will begin to whiten, and your doctor will apply a cool compress to the skin. You may feel stinging or burning for up to 20 minutes. No neutralizing solution is needed, though they may give you a handheld fan to cool your skin. If you've had the blue peel, you will have a blue coloring of your skin that may last for several days after the peel. During a deep chemical peel, you will be sedated. The doctor will use a cotton-tipped applicator to apply phenol to your skin. This will turn your skin white or gray. The procedure will be done in 15-minute portions to limit the skin exposure to the acid. What chemicals are used for the therapy? Since each chemical peel is slightly different, the exact formula depends on the treatment's intensity level. However, some of the most commonly used chemicals are beta hydroxy acid, alpha hydroxy acid, and trichloroacetic acid, and phenol. AHAs and BHAs are the lightest acids which are usually used in a light chemical based peels. Trichloroacetic acid is common for its various formulations, while phenol is only used in deep chemical peels since it is the strongest chemical peel. Chemical peel doesn't suit every skin type. You may not go for the therapy if you have abnormal pigmentation, facial warts, a history of abnormal skin scarring, aging skin, pale freckled skin, or undergone different acne treatments within the previous year. How do you prepare for a chemical peel? Before your procedure, you'll first have a consultation with a skincare specialist. They'll help you determine what the best treatment option is for you. They'll let you know the details about the specific peel you will be getting, and they'll ask about anything that could interfere with the peel. This may include whether you've taken acne medication and information about whether or not you scar easily. Before a chemical peel, you must not use any type of retinol or retin A topical medication for at least 48 hours. Inform your skincare specialist about any medications you take, not have been on Accutane for at least 6 months. Avoid certain cosmetic treatments and certain types of hair removal. Avoid unprotected sun exposure. Use a bleach agent and take antiviral medication. This is a before and after chemical peel. As you can see in the first picture, there are many wrinkles and fine lines, but after the chemical peel, there are very less wrinkles and fine lines. What to expect after a chemical peel? Recovery time varies depending on which chemical peel you receive. Light chemical peels, recovery time is about 4 to 7 days, and your skin may be temporarily be lighter or darker. While in medium chemical peels, your skin will recover about 5 to 7 days after a medium chemical peel, though you may have redness that persists for months. Your skin will initially swell and then form crusts and brown blotches before revealing new skin. While in deep chemical peels, it will cause severe swelling and redness with burning or throbbing sensations. It's common for the eyelids to swell shut. It will take about 2 weeks for the new skin to develop, though white spots or cysts may last for several weeks, and it's common for redness to last for several months. Who is a good candidate for a chemical peel? Generally, fair-skinned and light-haired patients are better candidates for chemical peels. If you have darker skin, you may also have good results depending upon the type of problem being treated. But you should also may be more likely to have an uneven skin tone after the procedure. Skin sags, bulges, and more severe wrinkles do not respond well to chemical peels. They may need other kinds of cosmetic surgical procedures such as laser resurfacing, a facelift, brow lift, eyelid lift, or soft tissue filler. A dermatologist, a surgeon can help determine the most appropriate type of treatment for you. The risks and possible side effects of a chemical peel. Yes, there are risks and possible side effects after a chemical peel. Common side effects are temporary and include redness, dryness, stinging or burning, and slight swelling. With deep peels, you may permanently lose the ability to tan your skin. Chemical peels can, however, have more serious risks and dangerous side effects that can be permanent. These include darkening or lightening of the skin color. These can be more common in people with darker skin, scarring, which can be permanent, heart, liver, or kidney damage. The phenol used in deep peels can actually damage the heart muscle, kidneys, and liver and cause irregular heartbeats. And it can also cause infections. People with herpes simplex may experience flares following a treatment. Very rarely, chemical peels can cause fungal or bacterial infections. A chemical peel is also not for everyone. Your doctor might caution against a chemical peel or certain types of chemical peels if you have taken the oral acne medication in the past 6 months, have a personal or family history of rigid area caused by an overgrowth of scar tissue, you're pregnant, or have frequent or severe outbreaks of cold sores. Chemical peel aftercare do's, which the things that you should do after a chemical peel are: do treat your skin gently, be extra careful when the skin is wet, wear sunscreen after chemical peel, limit your time outdoors, use products with soothing ingredients, use a natural skin brighter, and keep your skin care routine simple and gentle. Chemical peel aftercare, things that you should not do. Don't pick or pull at the flaky skin. Don't use a washcloth, facial scrub, or sonic cleansing brush. Don't over moisturize after a chemical peel. Don't exfoliate with acids or enzymes. Don't sweat too much after a chemical peel. And don't eat highly acidic foods. And also don't use any type of retinol or prescription retinoids. How much do chemical peel cost? Chemical peels are almost always considered a cosmetic procedure. The cost of the procedure will vary depending on factors like location, expertise of the provider, and what type of peel you want to get. Light peels can cost as low as $150 and deep peels can cost $3,000 or more. If you want to do chemical peel at home by yourself, the products are listed from the weakest to strongest, meaning from lightest to deepest chemical peel. Enzyme peels, mandelic acid, lactic acid, salicylic acid, glycolic acid, Jessner's peel, trichloroacetic acid. These are the chemicals which you can use at home by yourself for a chemical peel. How to do chemical peel at home. As always, it's best to consult with your primary healthcare professional first before deciding to do a chemical peel at home. This information is for educational purposes to ensure that if you choose to do a chemical peel, you have the accurate know-how. With whatever peel you start with, patch test first. For a patch test, apply a small amount of product on your arm. Apply a small amount of product on your skin in a discrete area like the inside of your wrist or your inner arm. Wait 48 hours to see if there's a reaction. Check the area at 96 hours after application to see if you have a delayed reaction. Incorporate it slowly into your routine. Your patients will be rewarded, and safety is of utmost importance. Chemical peel side effects at home. The side effects you may experience largely depend on the strength, intensity, and type of chemical peels you use. A little bit of redness post peel will occur, but should subside in an hour or two. Skin peeling may occur within 2 to 3 days. However, this is pretty uncommon with light superficial peels. As for the higher strength products, there'll be most like definitely be skin there'll most definitely be skin peeling and redness. This can last anywhere from 7 to 10 days. So make sure you're doing this peel when you can afford to stay at home. Rare side effects include change in skin color, infections, scarring, heart, kidney, or liver damage. Feedback. People have different feedbacks for the chemical peels. Some say it's not worth it, some say that they're not sure, and mostly people say go for it. But it really depends on the condition of your skin and the type of chemical peel you are getting. For most people, it is a success, but there are some people who are not satisfied with the chemical peel. According to an article, 67% of the people say it is worth it, while 7% say it is not worth it, while 4% say that they are not sure. These are the references for my presentation. Thank you. That is all for my presentation.